From Dose of Health, this is Abhishek, a specialist pharmacist currently working within the NHS in the UK. The year is 1948, and the streets of post-war Britain are alive with cautious optimism. In a modest town hall lit by the soft glow of gaslights and determined spirits of its people, a pivotal meeting is taking place, one that could shape the future of the nation. In the center of this gathering sits a man whose very presence seems to command the room, Aneurin Bevan. At a worn wooden table, Bevan sits surrounded by stacks of handwritten notes and carefully drafted proposals. His eyes, tired, yet unwavering, mirror both the deep scars of a nation ravaged by the war and the fierce promise of renewal. The air is thick with scent of old paper and the low hum of whispered debates as local officials, healthcare workers, and community leaders lean in to hear his every word. Bevan is not merely a spectator in this room. He is the architect of a vision. With a steady hand, he scribbles adjustments to a draft plan that outlines a radical idea: a health service free at the point of use for every citizen. He pauses occasionally to listen, nodding as voices around him raise concerns and hopes in equal measure. Every now and then, his gaze drifts to the faces in the crowd. Mothers who have lost loved ones to preventable diseases. Veterans still grappling with the physical and emotional wounds of battle. And workers who have struggled to rebuild their lives amid the rubble of the conflict. In that moment, Bevan is more than a politician. He is a symbol of possibility. He talks about hospitals that will no longer be the exclusive privilege of the wealthy, but safe havens for all. Places where the injured, the sick, and the weary can find care without the crippling burden of cost. Every word is measured, yet imbued with the raw conviction that comes only from seeing too much suffering to accept the status quo. This is the story of the National Health Service, a saga of transformation driven by the human resolve and an unyielding quest for equality. In that modest room, with the soft light of gas lamps casting long shadows on the walls, the blueprint of a new era in healthcare is being drawn. It is a moment of quiet revolution, where policy meets passion, and a determined man named Aneurin Bevan dares to reimagine what it means to care for a nation. In the days before the NHS, Britain's healthcare was a patchwork of charity and circumstance. In crammed hospital wards funded by uncertain donations, the fate of the sick and vulnerable was decided not by need, but by depth of persons' pockets. Records show that in the mid-19th century, the average life expectancy for a man was a mere 40.2 years. Diseases like cholera, typhoid, and influenza spread quickly, and many mothers lost their lives during childbirth. There was little help for those who could not pay. Back in the early 1900s, there were almost 800 voluntary hospitals, all relying on charity. Local authority hospitals, set up under old poor laws, did their best, but often had very few resources. The middle class, caught in between, struggled to pay for private care. People realized that this was not enough. They needed a better way, a system that cared for everyone, and not just the rich. On a brisk autumn morning in 1910, a visionary Liverpool physician, Dr. Benjamin Moore, set pen to paper in a modest study, proclaiming for the first time the idea of a national health service. His words were not a mere ink on paper. They were a spark. Alongside influential voices like the reformer Beatrice Webb, who had long argued in government committees for a state-supported medical service, and the novelist A.J. Cronin, whose 1937 work, The Citadel, exposed the desperate failings of a system, a movement was gathering force. These pioneers believed that healthcare was not a luxury reserved for the wealthy, but a fundamental right for every citizen. When World War II came, the weaknesses of the old system became even more obvious. Hospitals and medical teams were pushed to their limits. The emergency medical service was created during the war to help both soldiers and civilians. This service showed that a united, national approach to healthcare could save lives. In 1942, Sir William Beveridge published a report that would help build a new nation. His report listed 5 big problems that held Britain back: want, disease, ignorance, squalor, and idleness. He believed that by fighting these problems together, the country could be rebuilt. His idea gave hope that everyone should be taken care of. By 1944, the government released a paper called A National Health Service. The message was clear. Healthcare would be available to all, free at the point of use. Then, in the election of 1945, the Labour Party came into power, and Aneurin Bevan was chosen as Minister of Health. Bevan, who grew up in a working-class family, had seen the hardships caused by a broken healthcare system. He promised that no one would have to choose between their health and their money. Not everyone agreed with this plan. In one busy London hospital, leaders of British Medical Association argued that government control might hurt the quality of care. Some even compared the idea to systems in Nazi Germany. But Bevan stood firm. Through hard work and clear thinking, he won many over. His goal was simple: to make sure that every person in Britain could receive the care they needed without worrying about cost. Then, on a historic morning in July 1948, the NHS was officially unveiled. The declaration was not met with fanfare of bells or trumpets, but with a quiet, resolute murmur from a nation ready to embrace a new era. The corridors of newly nationalised hospitals buzzed with activity. Formerly segregated by wealth, patients of all backgrounds now received treatment side by side. The impact was immediate. In the first few years alone, millions of previously untreated individuals found access to life-saving medical services. The NHS did not stop there. Over time, it changed to meet new challenges. In 1974, the system reorganized to work better together. In the 80s and the 90s, new ideas were introduced to improve services. Even now, as the country faces new problems like rising costs and aging population, the NHS continues to care for its people. Today, thanks to NHS, life expectancy in Britain has grown by nearly 20 years since its start. Hospitals and clinics all over the country stand as a reminder of what can be achieved when a nation works together. Every saved life, every patient treated with care, tells a story of a promise kept. A promise that healthcare is a right and not a privilege. NHS is a story of simple ideas and great courage, of people coming together to build a fairer, kinder system. It is a story that began in a humble town hall in 1948 and lives on in every hospital room, every clinic, and every act of care across Britain. Thank you for joining this journey through history, a story that has shaped a nation and continues to inspire a future where care, compassion, and community remain the bedrock of society. Also, if you like this episode, please don't forget to like, share, and subscribe to this podcast on your preferred platform. Until next time, stay safe, folks.